Okay, tell me your best tips not to miss a melanoma.
The only way not to miss a melanoma never is not to do this job.
Yes, exactly. Change your profession.
Change your profession.
Yes.
And it's very successful. I mean,
Yes.
you will never miss a melanoma. But if you examine patients, you will miss some
Yeah.
melanomas.
But how you minimize?
The point is exactly to minimize and to not to repeat the same mistakes many times. For example, one very important is to look on the skin of your patients. I think that the most important reason why we miss melanoma is that we don't see it, not that we cannot recognize it. We don't see it because we focus on a specific problem and we don't do a thorough total body skin examination as we should. So that's the reason number one. Then the second thing is that you have to be able to deal with the fact that sometimes you don't know, and you have to be able to accept it, that you don't know, in order to take the wise decision when you don't know. If you're not able to accept it, then you're at risk to do something
wrong. Tell me what is, in your view, the most common benign lesions which are difficult to differentiate from melanoma?
There is a competition between seborrheic keratosis and nevus, because they are both not only very frequent, but they affect the entire population, almost. If I have to select seborrheic keratosis.
Seborrheic keratosis, even more than nevi. Interesting.
Since I have to select, yes, seborrheic keratosis.
Heavily pigmented seborrheic keratosis?
Not only heavily
inflamed,
pigmented, yeah, but also the ones that are not pigmented at all. The so-called irritated seborrheic keratosis sometimes are really, really challenging to discriminate, mainly from squamous cell carcinoma, not from melanoma, but very challenging. And also the heavily pigmented ones, they might be really similar to melanoma. The best clue for seborrheic keratosis, in my opinion, even for the difficult ones, is that they are very sharply demarcated.
Yes, like maybe they are touched on the skin, right?
The only clue that is still present also in the difficult ones, in the challenging ones.
You spend a lot of time to train doctors, right?
Yes.
You like to share your experiences and so on.
Yes.
What do you think is the main problems, the main difficulties that doctors which you train can experience in especially in using dermoscopy?
Time management is an issue for many of them. I mean that in order to do what we teach, so to do a very analytic, careful examination of the entire skin, come on, you need some time. Time, I mean, practically speaking, for the patient to undress, for you to go through all the lesions. So this sounds not important, but in a busy clinical practice, it might be very important. Second is training. Of course, it might look easy at the beginning to recognize these very characteristic patterns, but to be honest, it's not that easy. You need training, and this training has to be continuous. It's not that you take it once and it's there forever.
Tell me something wise. Tell me a wisdom concept concerning collision tumors.
First of all, there are some tumors that are very social, guys. They like a lot to socialize, to come very close to others. For example, basal cell carcinoma is very active.
Very social.
Yeah. Being in close contacts with many other lesions. Seborrheic keratosis also.
Yes.
So it's a matter of socialization on the one side. Collision tumors are open-minded, guys.
Wow, this is really wisdom. Collision tumors are open-minded entities.
Yes.
Yeah. Very good, very good. Thank you, Emilio.
Thank you.